you will have to think about the ophidia or snake poisons, as the doctor rightly said. The remedies like lachesis, remedies like botrops, remedies like Crotalus cascavella, Crotalus horridus, remedies like Vipera elaps. How will you give them? Typically, you will also now here look at sides. Lachesis will be more left-sided, which you already know. History of hemorrhagic stroke will give you more remedies like lachesis. If it's a case of thrombotic stroke, there is a thrombotic phenomenon, right? They see that there has been a stroke because of the thrombosis and not hemorrhage there. Then you will think about bothrops. Bothrops will have kind of a right-sided hemiplegia with aphasia. Even after the stroke, they develop one-sided hemiplegia with aphasia. They cannot speak. Other remedies for this? Other remedies for hemiplegia with aphasia? Anyone? No. Hemiplegia with aphasia. Chenopodium antihelminthicum. One more remedy. Chenopodium antihelminthicum. Another remedy, calibromanum. Calibrom. Calcium bromanum. Right? One-sided hemiplegia with aphasia. This is what I'm talking about. Let's come back to snake remedies for the first few things. I told you, lachesis you will find left-sided, as with hemorrhages, stroke. The face will be very distended, swollen. In lachesis, you will see that. Bothrops, I have seen it for any kind of thrombotic phenomenon. Straight away start with 30. Low potency works better with bothrops. Bothrops also very important remedy. Little later, after 7 days, after 15 days, when they are not able to walk, typically right-sided hemiplegia. Crotalus horridus, lot of not just hemorrhage, not of hemorrhagic stroke, but also it has what you will see is because all the platelets have gone down. Everything is gone down. You will see a lot of petechiae everywhere. Petechiae, ecchymosis, total swelling, total systemic failure with lot of bleeding everywhere. The blood outlet has gone down. Systemic blood effusion everywhere. You will have to give Crotalus horridus 1M, later on 10M. Crotalus horridus, Crotalus cascavella will not work. Crotalus cascavella is not a hemorrhagic remedy. It is a neurological remedy. Crotalus cascavella, a lot of proving has been done by Muir from Brazil, and he claims it to be a very important remedy for post-stroke right-sided hemiplegia. Remember, Crotalus cascavella, right-sided hemiplegia. Crotalus cascavella, the main symptom is clairvoyance, magnetic state. They're very magnetic people, very magnetic state. Crotalus cascavella, and Crotalus cascavella has fears like solanacea. Lot of fears. Fear of dark, fear of ghosts, fear of being alone, fear something will happen from somewhere. And the main feeling for Crotalus cascavella is that I am surrounded and anyone can come from any time and attack me. That's very important for Crotalus cascavella. It belongs to Crotalaceae family. Crotalus horridus, which is a big hemorrhagic remedy, is the most shy snake in homeopathy. It's the most timid snake in homeopathy. It's a kind of a snake, Crotalus horridus, which is exactly opposite to lachesis. Lachesis is one of the most charismatic snake. I'm not going to explain lachesis because you know lachesis. The loquacious lachesis, the envious lachesis, the jealous lachesis. If lachesis is on a stage, you cannot get his eyes out of you. If lachesis is around, it will be very difficult to get eyes away from lachesis because they are like that. They are very charismatic people. They have this kind of something in them that is very attention seeking. They make their life in such a way, they live their life in such a way, most of them, that it's very attention kind of seeking. That's the kind of people that they are. There are other types of lachesis also. Don't fix yourself to one lachesis. I even seen a very simple, humble lachesis also. So, but typical lachesis like that. Crotalus horridus is the most shy snake in homeopathy that I want you to remember. Crotalus horridus has an issue with the family members. He feels his family members are against him. So if you see the rubric family aversion to, estranged, timidity, you'll see the biggest snake is Crotalus horridus. And very often, in a lot of writings, you'll see Crotalus horridus has some issue with their father also. So they have a little father figure element there where they have a lot of issues with them. Crotalus horridus. So we spoke about Crotalus horridus, we spoke about Crotalus cascavella, we spoke about botrops, we spoke about lachesis. Elapse is more remedy which works on cerebellum. It works here on the cerebellum. So it's very important for cerebellar related, movement related, ataxia related symptom where the walking and the ataxia is typically affected. The vertigo, the RA system is typically affected. So very important action for elapse on cerebellum. There's a very nice symptom written in Gaurang. Oscillating movement. So they are constantly like this, oscillating. Gaurang last night. Oscillating movement. Also, one of the keynote of elapse I'll tell you, which I use here a lot also, is in case of rainy weather. In rainy weather, if you are seeing very obstinate chronic nasal clinkers, nasal catarrh, ear catarrh, and throat catarrh, think about elapse. Very hard clinkers in the ear. So it's a very important remedy for rainy weather. You already know that all snakes have rain aggravation. In fact, many snakes have fear of rains. We come to the next remedy, Naja. Also very important post-stroke neurological remedy. I'm just giving you a neurological remedy differential diagnosis. Okay, this all remedies how to use them. There are many more ways to understand, but I'm just giving you a differential diagnosis. So Naja has a specific action. Read Gaurang first line. Lot of action on medulla oblongata. So when you look at a materia medica, when you look at reports of a patient, and you look at the medulla oblongata is mainly affected, you want to look at Naja. This is a very important remedy for areas related to the brain of medulla oblongata. So medulla oblongata, you will think about Naja. More cerebellum, you will think about I spoke about elapse. This is how we all know Naja. I'm not going to tell you how Naja is so duty bound. I'm not going to tell you that Naja, for them, the main feeling is suffered wrong. It's something that you know, you all are practitioners. So I'm not going to tell you the typical materia medica, but I'm going to tell you clinical materia medica. Sorry? Feeling of worthlessness. Very important symptom of Naja. Delusion, everything is wrong. Sab galat hai. This is very important kind of sensation for Naja. The main idea of Naja actually, and you know that it belongs to the elapid family. There are two families, main families in snakes. One is elapid, one is crotalini. Right? And in elapid family, the main remedy that you want to know about is Naja, is elapse, is Sencris chondrotics. The main remedies in crotalini families, Crotalus horridus, Crotalus cascavella, and so on. The main differentiation is, one is the remedies belonging to elapid have more action on the nerves. The remedies belonging to crotalini, they are more hemotoxic. So Crotalus horridus, Crotalus cascavella, more hemotoxic. And the next important thing is, the remedies belonging to elapid family have more one-to-one fights. So they are the kind of people who will say, okay, the idea is, okay, no problem. Your phone is ringing once, is okay, no problem. It should not happen again. If it happens again, you are. Oh, this is the idea. Nothing will happen. You can pick up and take that, no problem. But this is the idea of the elapid family. Typically, also of Naja. They like to give the idea of giving a warning. It's very well known that comes in elapid family. And the other thing about the remedies like Naja and elapid families, there is more one-to-one. They are more solitary people. They are people who like to be on their own. You will not see 3-4 cobras together. You will not see that so easily. That's a very important solitary kind of people are more elapid family. You come to crotalini. Crotalini, the idea is not one-to-one. The idea is I am alone, you are all in a group. And that's why Crotalus horridus has an indication, delusion surrounded by enemy. So that's the feeling of Crotalus cascavella, Crotalus horridus, all remedies belong to crotalini family. I am alone, the whole world is against me. I am alone, I am going to fight it out with all of you. All of you do what you want, I am going to alone fight with you. This is the feeling of crotalini family. So I gave you a little differential diagnosis of Alnica.